a warning against massage when you have high blood pressure. One of the main symptoms of stroke. If you all of a sudden have neck pain, tightness in the back of the neck without any type of trauma, no neck injuries, don't be one of those people that think just one thing is going to lower your blood pressure. Well, good morning, everybody. June 15th, the 15th day of the 30-day Zipper Ninja Walk Challenge. Are you guys still walking out there? Hope you had an exciting weekend. And did you guys do your walk on Sunday? I did the walk, but I didn't do the video. However, we are back. Today is Monday. We have 15 days left of this 30-day challenge. I hope if you didn't do it with us this past couple weeks, I hope you can start now. We still have 2 weeks to go, and it really only takes 2 weeks of walking, and you will definitely see a reduction in your blood pressure. So we hope you will join us. If you've been following us the past couple of weeks, you would know that the first week we talked about things that you can control about blood pressure. The second week we talked about things that you cannot control about blood pressure. And this week we're going to talk about symptoms of blood pressure. Now, you may have heard from some people that, or some research, that hypertension or high blood pressure, there is no symptoms. Well, that's actually partially true. There are a few symptoms that accompanies high blood pressure, but they often are not the main indicator, or they're not the indicator of high blood pressure. You can have these symptoms whether you have high blood pressure or not. So this week we're going to talk about symptoms of high blood pressure. So the first symptom we're going to talk about is neck pain. And how is this type of neck pain different than other type of neck pain? So high blood pressure neck pain is not caused by any type of trauma. If you all of a sudden have neck pain, tightness in the back of the neck, maybe even feeling hot in the back of the neck without any type of trauma, no neck injuries, that could be a serious sign of sudden spike in your blood pressure, and also can be very dangerous. Three things about blood pressure. One, there's two main arteries that go up the back of the neck, and they go straight to your brain. So you can imagine the high pressure in this two arteries and what that can cause and what happens when it goes to your brain. That's one of the main symptoms of stroke. If you've experienced any type of sudden neck pain without trauma, tightness in the back of the neck, difficult to move your head, and then you check your blood pressure and it's really, really high, that is the time that you need to go to the hospital. The second thing about neck pain in relationship with high blood pressure is that studies have shown that when you have high blood pressure, it actually decreases your sensitivity to acute pain. And when that happens, you can have pain in your neck without even knowing that there's any problems there. So this type of acute pain eventually develops into chronic pain, and then chronic pain then in turn also increases your blood pressure. So you can have blood pressure problems before. Sometimes you can have blood pressure problem before pain. Sometimes you got a blood pressure problem after you start to experience chronic pain. So that's something else to think about when you have neck pain that's associated with high blood pressure. And the third and last thing about neck pain is some people have thought about getting neck massages. Well, with neck massage or massage in general, they're indicated, which means that they are recommended for people with high blood pressure, and yet at the same time they're also contraindicated, which is also a warning against massage when you have high blood pressure. And I'll explain right now. It's that massage is very good in helping you relax, helping your muscles relax, which will then in turn reduce your blood pressure. What happens is that when you start the actual mechanism of massaging causes intracellular pressure, which means there's increased pressure in the cells and also in the blood vessels. And what do you think that can happen? That type of pressure into the blood vessels then increases your blood pressure and the pressure inside your blood vessels. So how do you know when to go to get massage and when not to get a massage? If your blood pressure is spiking, those are the times you don't want to go get a massage, okay? If your blood pressure is pretty stable, those are times you can go get a massage, and sometimes because of stress, you can get massages, which will then relax you. Your blood pressure will go down. But again, if you're having blood pressure spikes, those are times that you may consider not getting massages because of the potential increase of intra blood vessel pressure, which then of course translates to the back of the head, which then increases your chance of getting a stroke. That's why sometimes when you go to massage, they check your blood pressure to make sure you do not have a spike, and if you have a spike, they'll most likely tell you to go to the ER and not even want to touch you. And that's the reason. So again, neck pain, something that's associated with blood pressure. Hopefully these 3 points help you so that you know what to do. Main thing, again, when I close, is that make sure you take your blood pressure medication, or at least do things to control it. Don't be one of those people that think just one thing is going to lower your blood pressure. Just drinking beet juice itself, just eating garlic, just one thing is not going to do it, okay? It has to be a change of lifestyle, so that everything that's in relationship to your blood pressure, to your blood vessels, to your heart, can help to decrease blood pressure overall. And hopefully that helped. And that concludes day 15 of the Zipper Ninja 30-day walk challenge. Hope you will walk with us for the rest of the 2 weeks, and we will see you tomorrow.